Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 5 NCLEX questions. Without delay, let's get started.
For the past 8 hours, a 20-year-old prima gravida client in active labor with intact membranes has been experiencing regular contractions. The fetal heart rate is 136 BPM with good variability. After determining that the client is still in the latent phase of labor, the nurse should observe the client for 1. Exhaustion, 2. Chills and fever, 3. Fluid overload, 4. Meconium-stained fluid. The correct answer is 1. The normal length of the latent stage of labor in a prima gravida client is 6 hours. If the client is having prolonged labor, the nurse should monitor the client for signs of exhaustion as well as dehydration. The primary healthcare provider prescribes scalp stimulation of the fetal head for a prima gravida client in active labor. When explaining to the client about this procedure, which of the following would the nurse include as a purpose? 1. Assessment of the fetal hematocrit level. 2. Increase in the strength of the contractions. 3. Increase in the fetal heart rate and variability. 4. Assessment of fetal position. The correct answer is 3. Fetal scalp stimulation is commonly prescribed when there is decreased fetal heart rate variability. The nurse assesses a primiparous client with ruptured membranes in labor for 20 hours. The nurse identifies late decelerations on the monitor and initiates standard procedures for the labor client with this wave pattern. Which intervention should the nurse perform? Select all that apply. 1. Administering oxygen via mask to the client. 2. Questioning the client about the effectiveness of pain relief. 3. Placing the client on her side. 4. Readjusting the monitor to a more comfortable position. 5. Applying an internal fetal monitor. The correct answers are 1, 3, and 5. Decelerations alert the nurse that the fetus is experiencing decreased blood flow from the placenta. Administering oxygen will increase tissue perfusion. Placing the mother on her side will increase placental perfusion and decrease cord compression. Using an internal fetal monitor would help in identifying a possible underlying cause of the decelerations. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at AlphaNurseGuide.com. Back to the questions. The most common reason given by mentally ill clients for noncompliance with medications is their uncomfortable adverse effects. When teaching the families, what needs should the nurse identify as the greatest? 1. Alternative ways to manage the adverse effects. 2. Home visits to set up a week's supply of medications. 3. Family monitoring of the administration of medication. 4. Outpatient monitoring of medication compliance. The correct answer is 1. Ways to decrease or manage adverse effects without additional medications is crucial. An elderly client was prescribed Ativan 1 mg 3 times a day to help calm her anxiety after her husband's death. The next day, the client calls her daughter asking when she is picking her up to go to the graveside. The client says she has been walking up and down the driveway for the past hour, waiting for her daughter. Noting the client's agitation, hyperactivity, and insistence, the daughter calls the nurse to report her mother's behavior. Which of the following would the nurse suspect as the cause of the mother's behavior? And what action would she suggest? 1. The client is manic and may need a sleeping pill. 2. The client is experiencing a medication interaction and should go to the emergency department. 3. The client is experiencing a paradoxical reaction to Ativan and should stop the new medication immediately. 4. The client is overcome by grief and probably needs an antidepressant. The correct answer is 3. Paradoxical responses to benzodiazepines are more common in children and the elderly than other age groups and generally occur at the beginning of treatment. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at AlphaNurseGuide.com.